Welcome back, everybody. With us this morning on Body Beautiful is oral and maxillofacial surgeon, easy for me to say, Dr. Casey Shimane. And today he's here to talk about dental implants. And first, let me remind you, we'll be taking your calls with any questions you have for Dr. Shimane. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we'll give you today. You want a second opinion. Always good advice, right?
That's right.
Welcome to the program, Dr. Shimane.
Thank you so much, Vicki.
The moment I mentioned dental implants, I mean, it just conjures up all kinds of images of like, ooh, that's got to be painful.
Yes.
Is it? No? Yes?
No, that's a misconception. Today with technology, general anesthesia, outpatient general anesthesia, very comfortable. Yeah, and as oral maxillofacial surgeons, we have that extensive training to provide that type of anesthesia, and we customize it according to what the patients want.
I guess the bottom line here is that if you need a dental implant or if you need some kind of device, first let's establish that you do need those.
Yes.
There are folks who think if they miss a tooth and they can kind of, if it's back there, it won't show. But the teeth are all like, it's like dominoes. So every tooth is important to the whole basic structure.
Correct.
Right?
Correct. We replace single teeth when you're missing teeth, but like I'll talk about later on, we can replace all of the teeth. And that's the new, or one of the innovative things that people aren't aware of.
Okay, so you're saying you can replace it, but not dentures. We're not talking about dentures.
No, but it's a type of a hybrid prosthesis where it's a denture and it's a bridge for patients with no teeth.
And so this would be for people who've either had an accident or who have periodontal problems, or why would someone need to replace?
Exactly. Well, some people are just missing teeth, like good old grandma, having the teeth in the glass. Other patients, younger patients, they had a car accident, they had a tumor resection, and it's unfortunate, and they deserve more in their life.
Yeah, well, everybody loves a big, toothy smile, gleaming, teeth. And again, we're kind of jumping ahead because basically, normally, if somebody's going to have an implant, we're talking maybe one or two, or how does that work when somebody comes to you and says, I need your help, Dr. Shimane?
Yeah, single teeth implants are very common. The most difficult ones, of course, are the anterior front teeth. You could replace multiple teeth, and in more extensive cases, we could replace all the teeth, and not just with dentures that clip on, like a button for pants. We could actually have a bridge made. A bridge that has denture teeth. It's a metal-based bridge, and they could function just like they had teeth when they're 20, with no teeth.
Okay, let's go ahead and, you brought some pictures here, so let's go ahead and take a look at that so folks can get an idea what we're talking about. What is this here?
Yes, this is an animation of a CT-guided surgery that we perform. The patient was sent for a CT scan. That's the patient's denture, and this is what we use to plan out the surgery. The dental implants are placed on the computer, on my laptop actually, and the three-dimensional configuration and positions are all predetermined, as you can see there, those 6 implants.
This high-tech kind of enables you to, you're precise.
Precise,
so
dead
there's
on.
no ill-fitting, this is
as
nature intended it.
Yes, for most cases it's very accurate, and we're actually able sometimes to place the implants or the temporary prosthesis same day.
So, same day?
Same day.
It's my understanding when you have implants that you go in and you screw in into the bone, right, first, and then you come back, you put something temporary, and then you have to come back. No, you can do this all?
Yes. Some cases we can, some cases we can't, and there's a criteria that we use, a standard protocol of, we call it torque stability, where you tighten it, and if it meets it, great. And we actually use something called radio frequency, which is the newer technology people don't know about. And
okay. Do you want to, I think we have like 1 minute before the break, but radio frequency? How does that factor?
We put a little peg on, and from radio frequency, it vibrates the implant very minimally, and it gets a number registers, and it tells you roughly if the implant is stable. So you don't have to wait many times, 4 to 6 months. Immediate.
Wow, on the spot.
Immediate.
That's fantastic. And of course, the beauty of this, we want to talk about bridges and all kinds of alternatives, but the beauty of the implant is that it's permanent, right? I mean, it's in there.
Long-term, Vicki. It's 40-year track record.
You don't need your denture cream. You don't need. It's just it's in there for good.
No.
Okay. All right. Well, Doc, we're going to take a quick break here, but for more information about Dr. Shimane, who we've just been talking to, you can call him 510-885-8720 or go to Castro Valley Implants. When we come back on Body Beautiful, we'll continue our chat about dental implants with Dr. Casey Shimane, and it looks like we've got quite a few calls coming in, Dr. Shimane, so we'll be sure to take those. We'll be right back. Welcome back to Body Beautiful. We'll be taking your calls. We've got quite a few of them stacking up here. Any questions you might have for Dr. Shimane about dental implants, the phone number 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment, so be ready with your pen and paper to jot that down. And we always say this, remember, any advice we give you today, you're going to certainly want to consult your own physician as well for a second opinion. Doctor, who exactly would be a good candidate for implants?
For implants, it's such a wide array. Definitely consultation would be helpful and required. But single teeth, multiple teeth, and all the teeth. Okay.
Well, you have some pictures here, so let's go ahead and get a look at some of the before and afters, and that'll give us an idea. Okay, he's missing his front teeth.
Yeah, actually, he's missing all of the upper teeth. And so we use this CT-guided technology for this gentleman.
And we saw that earlier.
Yes, that animation shows his actual surgery.
If you didn't know what his teeth looked like beforehand, how can you devise the teeth? Is that what that does?
We asked the general dentist, the restorative dentist, to make a denture first, and then we planned the final, this temporary hybrid prosthesis from that denture. Okay. So this is a photo of his edentulous, or
those are his gums without the teeth. Okay.
And this is actually a photo of the temporary hybrid prosthesis. Okay. And you can see it has metal in it, so it has strength, and it has denture teeth. So from having no teeth to having an actual bridge, patients are able to...
Yeah, but this is permanent. This is not something you put in a jar afterwards, right?
No, this is fixed. They cannot remove it. This is actually a better photo to show, aesthetics-wise, that, yeah, it's actually a pretty outcome.
Now, we're going to see him with his full smile here?
Yes, and that should be coming up also.
Okay. Let's take a look. And so those are, and again, that's permanent, and they won't shift around, they won't click.
Locked in.
There he is.
There he is with his smile.
Better.
Such a happy guy.
Yeah, what a difference, night and day. Okay, I promised we'd be taking some phone calls, so let's go ahead. Cheryl, San Leandro, good morning. Cheryl, do you have a question for Dr. Shimane?
I do. I went in and I had my teeth fitted for cosmetic crowns because I take antibiotics that has really destroyed my teeth, and I've had quite a few surgeries. And when I went in, it was the front crowns and a partial on the top and on the back, but I never went back because of the pain was so severe. So now I have my teeth ground down to nothing, and they're getting infected to where I just go in and I have them removed. What are my options?
Okay, well, definitely the first thing you should do is consult with your restorative dentist or general dentist to have a game plan, a treatment plan. And as specialists, we coordinate very closely with that general dentist to figure out what needs to be removed, what needs to be saved. And at our consultations, we help or assist the restorative dentist with a plan. If we think that implants would be helpful, if there's bone grafting that's possible, we'll review all that with you and convey that to the dentist.
Okay, thank you very much, Cheryl. Let's move on to Cornelia from Oakland. Good morning, Cornelia.
Yeah.
Do you have a question for the doctor?
Yes. I wanted to know, with the dental implant, I have partial already, and I wanted to know if the dental implant would, well, I have a problem with my facial structure. So would he be able to do the dental implant with the way my facial structure is? It's like my mouth is not completely straight.
Okay, I think you're asking me if you're going to have late facial or loss of facial support from keeping the partial. I believe that's what you're asking me. And if that's the case, yes, you do have bone atrophy. Anytime you have teeth removed, over time, you're going to lose bone. And that's why we always help educate our patients to say, if you're going to have teeth removed, consider it early on. Don't wait. 5, 10 years out, you may not be a candidate anymore.
Thank you, Cornelia. Let's try to get Maria from Alameda. Good morning, Maria. Do you have a quick question for the doctor?
Yes. I want to find out what is the guarantee for against infection for implants.
Okay.
And also to their insurances doesn't cover the $3,000 for each tooth that it costs to the implant. Why so expensive to start with?
Thank you, Maria. We have 30 seconds for an answer.
Okay.
Put you on the spot,
Here we
Doctor.
go. I think you're asking about infection rate. Very, very, very low. Success rates for most dental implants, 95%. And your question about insurance, most companies, it really depends on the plan. You'd have to go step by step and ask the office.
Thank you, Maria. Unfortunately, we are out of time. Dr. Shimane, it's been fascinating. There's so much more to talk about. We'll have to have you back, I guess. But for more information about Dr. Casey Shimane, call him at 510-885-8720 or go to CastroValleyImplants.com. And join us again at 11 a.m. next Tuesday for yet another edition of Body Beautiful. Thanks for joining us. Have a great day, everybody. For more information about our show, go to KRON4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.